Let's dive into the discussions shaping the nation.
Minister, I hope we can both agree that we need more GP care in this country, and in particular in Dublin's North Inner City, in the constituency we are both elected to represent. My question to you today is, what are you going to do as Minister for Finance to stave off the closure of the GP Care for All practice in Summerhill in Dublin 1? As you and I know, this GP care practice is run by a medical charity. It directly employs GPs simply because no one else has been willing to set up a GP practice there, simply because the partnership model of privately owned GP practices would not work there. And the double taxation issue with regards to the GP practice arose in early 2024. It's been already well aired, and the reality is in 2025 we've had no progress. We've had unworkable solutions from the Department of Health, two of those solutions vetoed by the HSE. We have a farcical situation where the HSE has paid for legal and accountancy advice to be given to the Department of Finance, and we've heard nothing back from your department, the department that instigated this mess in the first place. Former Minister for Health Stephen Donnelly went on RT's primetime last November in the middle of the election campaign and said, no way are we going to let this practice close. He went on to say, not only is it not going to close, but we are going to use it as a pilot and open a practice in Finglas. So, Minister, what is happening here? The 5 GPs are telling us that they cannot stay open past June if the double income tax payment issue is not resolved. And if it does, the impact will be devastating, not only for the 2,600 patients of that practice. This isn't just about Summerhill. It is about Finglas, where we've got 14 GPs on the GMS scheme in Finglas East and 0 GPs in Finglas West. It is about the dire shortages that we see right across this country in terms of timely access to GP care. And it's about the impact of these shortages, the delayed diagnosis, the deterioration of people's conditions, the increased hospitalisations, the premature deaths. The reason we have these shortages is because of the private system of GP care in Ireland. Time and again, when we talk to trainee GPs, they tell us they want to work as clinicians. They don't want to set up their businesses. And yet, at the moment, the only way that we can ensure GP care in some of the most socially deprived parts of our communities is for the HSE to recruit directly or to let medical charities continue in operation. Minister, we need to join the dots here. Even the Lancet this week pronounced on how we need to change. They devoted a whole editorial to their March edition on how Ireland is an outlier with a private system of GP care, how our inaccessible primary care system places tremendous strain on hospitals, how this is a political choice. I have to say to you, Minister, that this is a double taxation issue. The buck stops with you. So I'm asking you now, Minister, what you're going to do to save this medical charity and other medical charities around this country.
So thank you, Deputy, for raising an issue that I am familiar with, and I want to in particular recognise the work that GP Care for All have done and their person who's at the heart of it, Amanda Farrelly. I was actually hoping to meet them myself tomorrow, but another government commitment has got in the way. But I'm well aware of the importance of the work they do and the value of the service. And while I do very much welcome and acknowledge your right to raise this here, Deputy Marie Sherlock, points like you making that the Department of Finance are at the heart of this mess, I think do disservice to the complexity of this issue, and I hope a bipartisan approach to try and correct it and play a role in it. You, I know, are aware that the HSE do want to recruit GPs who can work directly for the public service. I know you're aware of changes that have already been made to tax legislation to try to deal with this issue, changes that were made by my predecessor, Minister Jack Chambers, looking to deal with an issue that had been raised that unfortunately hasn't made the progress that we would have hoped. And again, I hope and know you're aware of how much work has gone on in the Department of Health and in the Ministry of Finance to try to identify options for dealing with this issue that so far have not yet had the success that we would want. The very heart of this issue, as you well know, is the relationship that is in place from a contractual perspective between GPs and the HSE that goes back to legislation from 1970 and the tax consequences of this that mean that as a matter of law, income under a GMS contract belongs to the GP who entered into the contract with the HSE, an assessment that was confirmed by the Tax Appeals Commission determination in January of 2022. So that's the background to this issue. There are officials and there are politicians of goodwill who've worked to try and find a way of resolving this. And I, as Minister for Finance, in conjunction with my colleague, the Minister for Health, will continue to do what we can to try to make progress on this issue. If goodwill alone could have solved this issue, that would have happened. And you know that is the case, Deputy Sherlock. You know that work has happened in relation to it. And myself and Minister McNeill will prioritise this issue. We will look at the options that are there. And certainly from a tax perspective, I will engage on this issue and see if steps can be put in place. I look at the progress that we have made in opening up a primary care centre on Summerhill, what that means for those in Sean O'Casey Avenue, for the surrounding communities, the difference that it's making in a health perspective. And I look at the great work that these GPs are doing, who you are raising this issue on their behalf, and I know the impact, the role that plays in supporting the health of their patients. So we're going to do our very best on this issue, and I thank you for raising it,
Deputy Sherlock, 1 minute.
Yeah, thank you, Minister. And Minister, I think there's obviously goodwill on all our part towards the practice, but what I'm not hearing today is a sense of urgency with regards to the situation. And we have the chair and we have the practice manager here in the public gallery today, and they're waiting to hear answers from you. The reality is that of the 2,600 patients in this practice, they're some of the most vulnerable people, as you and I know, in our community. This practice is turning away 10 to 15 patients per day. The stalemate at the moment is preventing the opening up of a further list in this community. So there's people currently not accessing GP care at all, and with regards to the plans in Finglas and other parts of the country. So I'm asking you, Minister, to bring a sense of urgency to this. The reality, as we understand it, is that the changes that were instigated in the 2023 Act were designed to try and tackle corporates taking over private GP practices, and as I understand it, they're actually managing to, they found a loophole, and yet the people not who shouldn't be affected by this, the medical charities, are being affected. That's wrong.
So Deputy Sherlock knows we're treating this issue with urgency. You know that. You know the Minister is. You've acknowledged that to me. You know we are working on it. You do the issue a disservice by suggesting otherwise. Please acknowledge, as I have done, that if this was an issue that was simple, that could easily be dealt with, we'd already have done so. What we have acknowledged here is this is a complex issue, and unfortunately that complexity means that a group of deeply committed healthcare professionals who have decided to provide services in communities that you and I are lucky enough to represent are now facing the vista of them not being able to continue that work. And those who are suffering or could suffer from that is the health of those that we are doing our best to stand by. What I've done is outline the work that has already happened with regard to this, Deputy, which I know you're aware of. We have put in place different options to try to resolve the issue, but I know they're not leading to the outcome that I want.
Thank you,
if I was in a position to outline a detailed solution to this today, that detailed solution would now be implemented.
Thank you. Deputy
and what
Brian
we will
Stanley.
do is
Thank
continue
you,
to work on this issue, Count
Deputy Brian
and do our
Stanley.
best to find a solution to it. Thank you.
Deputy Brian Stanley.
Thanks, Count.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.